Hi everybody, I'm just going to spend 4 or 5 minutes going through a couple of exercises that are really good to relieve tension that's running down the back of your leg, or you might be having referred pain that's going into the groin or into the thigh. These exercises we call sliders and gliders. They're also called neurodynamics or nerve flossing. Okay, so we start off with flossing the sciatic nerves if you're getting pain that's going down into the buttock, into the back of the leg. I'll show you this with me lying on my right side, but you would do it based on which leg or which side you're having trouble with. So my hand's underneath the pillow here, so you can really relax your head, no tension in the neck muscles. And all I'm going to do to start off with, I'll just show you that there's two parts to the exercise. The first part is I'm just going to straighten the knee, and as my knee starts to straighten, I'm going to bring the foot back towards me and curl my toes back towards me. And then the second part is I'm going to point my foot down as the knee bends. I'll keep pointing the foot down and drawing it back as far as is comfortable, and then going again. So the knee straightens, the foot starts to come back, and the toes point back towards me. Okay, now if you're really sensitive to that movement, if it really brings on pain down the leg, just stop where you start to feel a little tiny bit of tension in that part of your leg. Okay, so don't stretch and don't hurt yourself doing this. So I can go right the way through into that movement and right the way back. You might find that you're limited to how far you can do it at the moment until you build up that kind of mobility and that ease of movement. So the second really important part of this exercise is as the leg starts to straighten and I feel a bit of tension in the back of the leg, my head drops right the way back as far as I can go, which takes away that feeling of tension. So if I do that, I can feel a bit of tension running down the back of my leg. If I point my foot down, it disappears. If I bring the foot back, it comes back. As my head goes back, it reduces. Okay, so you put that all together and the exercise looks like this. So everything moves at the same time. So the leg starts to straighten, the toes come back, and my head flops back. And my head going forward, sliding it on the pillow. Okay, so it's not holding the neck up like that, which can just be too much like hard work. So the head slides through, foot points down, and then back again to go through to the next part. It's nice and gentle, nice and slow, and I'm not feeling major tension anywhere, because as I tension one half of me, the other side slackens off, and then vice versa as we go that way. Okay, so 10, 12, 15 of those per go. So that would be relieving the sciatic nerve tension. And then the opposite, the femoral nerve, which is the nerve that's slightly higher up in your back, the head sort of does the same things. The head drops back and then back to neutral. So in this exercise, the head only drops back. It doesn't then go forwards. Okay. The leg does the opposite. The leg goes back. So you're moving this one more at the hip. The hip kind of goes backwards. So here I'm pointing my foot down, extending the hip, okay, and then back to neutral. So you don't necessarily, in this one, you wouldn't need to go all the way back through the exercise. It's just from a neutral start, extending all the way back, and then to the start again. So you add that up with the head movement, and it looks like this. Again, nice and slow. And what you might feel here is that position drags a little bit on into the groin, into the front of the thigh, okay? Which you might think is muscular, you might think it's muscle tension, but actually that's not. That's you feeling a little pull on the femoral nerve. So take it easy. You don't want to push and push and push and push and feel that burn. You just want to feel that there's something going on there that changes with a change in position. So the head going back and the leg coming forward should take away that tension. Okay, and exactly the same thing with the sciatic nerves. You'd be doing one or the other. If you had pain down the back of the thigh, you'd do this one. And if it was groin or thigh, then you'd do this one. You don't necessarily need to do both. And also you wouldn't necessarily need to do both sides. Okay, so this is more targeting the side that is troublesome. Okay, and if you find that exercise relieves tension, then you'd leave it a couple of hours, do it again, and try and do it throughout the day, maybe a handful of times. But just being aware that it is the kind of exercise that if you push too hard, too quick, it can just flare things up a little bit. So take it easy, and this is an exercise that's, you do it mindfully, you do it slowly, you do it with time to kind of tune in to how it feels when you're doing it, because you want to know that if you're doing it 10 or 15 repetitions, by the time you hit 5, 6 or 7, you want to make sure that it's starting to feel a little bit easier. And if it's going the other way, if you're doing 5 or 6 repetitions and you feel it's sparking more and more tension, or you feel like it's pushing against more and more tension, then you back off. Okay, so think less of it being a no pain no gain exercise. Okay, it's not a stretch. Think of to it, not through it. Think that you're just trying to ease things up a little bit, and if it helps, you just come back to it as often as you like.